I was asked about foods that might aggravate fibromyalgia. I'm going to get into a specific type of food in just a moment. I think you'll find it very interesting.
Dr. Mark Dailey is president and CEO of Birmingham Functional Medicine, founder of Fibromyalgia University, a certified functional medicine practitioner, and a nutritional counselor with advanced education in functional endocrinology, functional blood chemistry, the brain and neurotransmitters, and thyroid function. With over 25 years in clinical practice, he focuses on chronic conditions like fibromyalgia, chronic fatigue syndrome, irritable bowel syndrome, as well as autoimmune conditions. Let me introduce Dr. Mark Dailey.
So today we're going to talk about a particular type of food that may aggravate fibromyalgia. Now, I have to say before we move into this particular food group that there are many things, and it's not always the same thing for every person. But what I do see a lot in the food sensitivity testing is dairy products, wheat, corn, soy, that might aggravate fibromyalgia. Also, for some people, you may not like this, but for some people, eggs are an aggravating factor. And we do find that out by doing the sensitivity testing, food sensitivity testing. But today we're going to talk about oxalates. Now, oxalates or oxalic acid is a compound that's found in a variety of plant-based foods. Under a microscope, oxalates are jagged in structure and look somewhat like crystal or broken glass, if you will. During metabolism, oxalate acid or oxalic acid combines with other minerals like calcium, sodium, magnesium, and potassium to form compounds like calcium oxalate or sodium oxalate in the kidneys. This in turn may be responsible for mineral deficiencies. Now, one of the most common issues with increased oxalates in the urine is kidney stones. However, if the body struggles to eliminate these oxalates, it can accumulate as crystals anywhere in the body. They commonly accumulate in the blood, then the eyes, the bones, the skin, the muscles, blood vessels, the heart, and even a variety of different organs. High oxalates have also been linked with autism and inflammatory bowel disease. It can also be an underlying issue in those with ongoing gastrointestinal problems like irritable bowel syndrome. Tissue destruction, fibromyalgia, and autoimmune diseases such as rheumatoid arthritis and lupus are all issues that can be related to oxalates because oxalate in tissues trigger the inflammasome reaction of the body's innate immune system. Side note, the thyroid will also suffer as oxalates can bind to T3 and disturb thyroid function. I'll share a list of vegetables and foods that should be helpful in identifying foods in your diet that are high in oxalates. Now get this, spinach, although green and leafy, contains 900 milligrams of oxalates, and the recommended dose is less than 40 or 50 milligrams. So your green smoothie may actually be contributing to a host of health issues. Low oxalate diets involve eating less foods that are high in oxalates, obviously. Foods high in oxalate include certain types of fruits, vegetables, nuts, grains, and legumes. So on a high oxalate diet, you should limit your oxalates, as I mentioned, to 40 to 50 milligrams, each day. In summary, whether for kidney stones prevention or to address other possible chronic health conditions, a low oxalate diet may be helpful. On a low oxalate diet, you may notice a decreased risk of kidney stones, improved mineral absorption, diminished joint and muscle pain, which is a big deal for those suffering with fibromyalgia. Improvements in fibromyalgia often occur, as well as autism symptoms and improvements in autoimmune diseases. So you can take a screenshot of the picture that I had of that chart, or I'll try to leave a link in the description so you can print that out and just take a look at your diet as it relates to the oxalate content. I hope that was helpful. If so, would you please subscribe to the channel, like the video so that other people struggling with this condition can find us. Thanks so much, guys. If I can be of any help to you, I'll leave my clinic phone number here. We do have a recovery program for fibromyalgia called Fibromyalgia Heroes. And of course, I'm a functional medicine practitioner, so we help people with chronic disease. Thanks so much, guys. God bless you and have a great day.
Dr. Mark Dailey is the founder of Fibromyalgia University, the president of Birmingham Functional Medicine, creator of Fibromyalgia Heroes, which is a coaching and implementation recovery program. He is a certified functional medicine practitioner, a nutritional counselor, and a doctor of chiropractic. He has advanced education in functional endocrinology, functional blood chemistry, the brain and neurotransmitters, as well as thyroid function.